So indeterminate results. Well, first of all, indeterminate results are relatively uncommon. Only about 10 to 12% of the more than 30,000 ambiguous melanocytic neoplasms that we've tested produce an indeterminate myPath result. What that means is that the vast majority of what is ambiguous to us at the histopathologic level is not ambiguous at the molecular level, at least not with the myPath test. Those ambiguous neoplasms are generally wholly benign or fully malignant. Now, for those cases that do produce an indeterminate zone result, there are essentially two possible explanations: dilution effect and what we'll call biological intermediacy. So dilution effect can occur when a very small volume of malignant cells is admixed with a much larger volume of benign cells. Now, the myPath test is very sensitive. It reliably detects even very small melanomas, and our limited detection studies have shown that it accurately and reliably detects melanoma even when benign cells outnumber malignant cells by a ratio of more than 20 to 1. So the vast majority of these very small, very early stage melanomas are reliably detected. Melanomas arising within nevi are reliably detected. But when malignant cells comprise less than about 5% of the total volume of analyzed tissue, there is at least an increased possibility of an indeterminate zone result due to this dilution effect. So that's the first possibility. The second possibility is biological intermediacy, a tumor whose capacity for progression and metastatic capability lies somewhere between that of a wholly benign nevus and a fully evolved melanoma. So these are lesions that might progress, might have the capacity to involve regional lymph nodes, but probably have little or no capacity to extend beyond the regional lymph nodes. Or they're lesions that are benign at the time the biopsy was performed, but have an increased propensity to acquire the capacity for progression or metastasis if they were left to pursue their natural course. At least some of them we might expect would eventually evolve into fully malignant melanoma. So regardless of which of those scenarios applies, indeterminate results are best considered very carefully and on a case-by-case basis. It's probably fair to say that many myPath users consider an indeterminate result to be indicative of a lesion that at least warrants complete re-excision.